The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, Ph.D. Welcome to Pediatric Perspectives, where we are looking at children's health challenges from a different perspective, one that includes critical thinking and one that's not afraid to give you the honest truth. My guest today is Josh Guetzkow. And Josh, welcome back to the show. I know we've talked, it's been a while. It's so great to have you back.
Been a couple of years, Paul. It's great to see you.
Way too long. Dr. Guetzkow is a university professor in Israel, in fact, coming to us from Israel as we speak with expertise, and his classes are in criminology and sociology. We're going to talk about your recently published or released study on the impact of mRNA COVID-19 vaccines on pregnancy loss. And that's a tough thing to deal with because of complications with dealing with what's the baseline and all of that. The paper's called Observed to Expected Fetal Losses Following mRNA COVID-19 Vaccination in Early Pregnancy. And that's a masterpiece of an article. I plowed through it, but I will have you talk about it. I mean, we got 26 pages of the study, over 50 references. How about starting for us? I mean, this is a children's health show, but children begin in the womb. So what happens during pregnancy, as far as I'm concerned, is vital. And I'm interested in why this study now?
We've been working on the study for a good 2 years, and that's part of the reason why I haven't talked with you, because I've been so focused on this. We started it because there was, first of all, as you know, the original clinical trials didn't include pregnant women. Pfizer eventually did do a clinical trial on their mRNA COVID-19 vaccine that only included women who were basically at the very end of the second trimester or beginning of third trimester. And the other research that had been done had mostly been done on vaccination and later pregnancy. So we felt there was a lack of research on COVID vaccination and early pregnancy, partly. And also we felt that there were numerous biases in the research that had been done, that we felt we could take a new approach and try to correct it and come at it from a different direction that would not introduce those types of biases. So those, and in addition to that, we have many people, there's lots of anecdotal evidence of pregnancy loss following COVID-19 vaccination. So taking all of those together, we felt it was a very worthwhile thing to do.
And I think you're absolutely right. What I've found out to be happening, and you can speak to this, women are being recommended or advised to get the COVID shot even in the first trimester. At least it happens, right?
Absolutely. I mean, if you go to a pharmacist, you want to get a vaccination, they'll give it to you. They're not going to ask what month you are. And as far as I know, the recommendation for pregnancy, COVID vaccination and pregnancy doesn't tell you to wait until later in pregnancy. In Israel, they started rolling out the vaccinations in mid-December. By mid-January, they were already recommending it for women in the second and third trimester.
You're talking January 2021?
Yes, mid-January 2021. There's basically no evidence whatsoever about its safety in pregnancy, but they still recommended it. And in fact, Freedom of Information Act request showed that the reason they didn't recommend it in the first trimester is simply because there's such a higher risk of miscarriage in the first trimester. They didn't want women to make a false connection, they thought, between vaccination and pregnancy loss. And so they didn't recommend it because they didn't want to sort of give the vaccine a bad name. But just 2 weeks later, on February 1st, they expanded the recommendation to include all women at all stages of pregnancy. And it's and that recommendation still stands today.
So if you're in Israel and you go into your doctor while you're pregnant for OB care, they will recommend that vaccine.
I believe so. I believe so. I mean, I get an annual recommendation for it in my email.
Why is Israel's experience unique and important?
One of the unique experiences of Israel is that the government made a deal with Pfizer. They told Pfizer, you give us advanced, like the earliest doses. We want to vaccinate our entire population as much as possible at the very beginning of the availability of the vaccine. You supply us with those vaccine doses, and we will supply you with the health data of the entire population. And we can then publish papers and do research talking about the efficacy, the effectiveness and safety of the vaccine in the entire population. And that's exactly what happened. The first paper that was published about the real world effectiveness of the vaccine was published in the New England Journal of Medicine from Israeli researchers in cooperation with Pfizer in, I think it was just early February, maybe mid-February of 2021. And many, many other papers have been published. And our data is actually from, so Israel has some different insurance companies that are sort of public-private. And our data comes from one of those insurers that covers about a quarter of the Israeli population.
So that's a big data set with how many people roughly in the data set?
2.6 million people covered. Yeah.
Wow. And how many of those were pregnant women?
So our study covers several years. I can talk with you a little bit about the methodology. Totally, we were analyzing about 260,000 pregnancies. About 100,000 of those came from the COVID period that we looked at, 2020 to 2022.
Wow. Yeah, let's delve. I'm really curious to learn what you found. Let's go ahead and talk about the study and what your findings were.
Okay, so we used this method called observed to expected, where you look at the observed number of events compared to a historical baseline of expected number. And what we found is that women vaccinated with dose 1 in the first trimester, we specifically started looking at women at week 8. So weeks 8 to 13, first trimester, we expected to see 9 fetal losses per woman. We saw 13 approximately. So it's about 4 additional fetal losses per 100 women who were vaccinated in those weeks in the first trimester. We saw a similar difference for dose 2 because most women who got dose 1 went on to get dose 2. We see a slightly smaller observed to expected for dose 3. These are women then who are in those weeks of pregnancy in August, September, October of 2021, when Israel was again the first population in the world to receive widespread booster doses. And in fact, this difference that we have see smaller number of observed, the difference between observed to expected. So it's an additional 2 fetal losses per 100 women vaccinated in those weeks could point to a dose response relationship, because with dose 1, women were getting dose 1 and 2 in those early weeks. So they're getting 2 doses during pregnancy, and most of them. And for dose 3, they're only getting that 1 dose in that critical period. There's something that's really important to point out about this, because the timing of when were women losing their pregnancies vis-a-vis the vaccination. So it was rarely a situation where a woman would get vaccinated and then lose her pregnancy right away. And in fact, we sort of did this observed to expected over the course of pregnancy. And what we found is that over half of those additional fetal losses, those 4 fetal losses, about over half of that occurred from week 20 onwards. In other words, week 20 is when most countries define stillbirths. So from week 20 on, over half of the fetal losses that were observed, additional fetal losses that were observed, occurred as stillbirths. Wow. And almost half of them occurred from week 25 onwards. And that's important because so what we look at, our outcome is fetal loss, and that could be for any reason. It could be a miscarriage, it could be a stillbirth, it could be an induced abortion, and it also includes elective abortions. And one of the possibilities is that, well, women were going out and getting more elective abortions during the COVID period. After all, it was such a unique period. Maybe this additional that we're seeing is based on elective abortion. But in Israel, very, very few women get abortions, elective abortions, after week 20. And after week 25, it's unheard of. There are regulations against it.
Right.
It's essentially impossible.
That's basically a viable infant at 25 weeks. You can survive and live at 25 weeks. So
Right.
nobody's going to do an abortion at that age. And in fact, I think the reality was there was less healthcare during COVID lockdown and shutdown. So in effect, there would have been fewer elective abortions, would be my guess.
There were, and there's actually a report from the government tracking the sort of all these different abortion outcomes, and they show a decline over time, including the COVID period, this sort of general decline in the number of women having elective abortions, especially in later weeks. So, there's very clear signals of harm here, and even more concerning that the signal happened so much later in pregnancy. These additional losses occurred later in pregnancy, which is kind of horrific.
So in Israel, they are still recommending this COVID shot in pregnancy, just straight out, no ifs, ands, or buts, right?
I mean, we're hoping that once our paper actually gets published. Currently, it's a preprint; it hasn't been through peer review. But we're hoping that once it gets published, it may have some impact on public health recommendations here in Israel. Certainly, other countries are taking a more cautious approach. Japan, US just changed their guidelines. They're no longer recommending the COVID vaccination for healthy women, and they're not recommending it. They're they're neutral. And Japan just changed their guidelines on that. They're not recommending it for pregnant women. So there is some change happening.
Yeah. I know if you're in the US and you go to your OBGYN, and the way the new recommendations out of the CDC are worded, you and your OBGYN are to make the decision yourselves. So they're not absolutely saying you should get it, but they're leaving it up to the doctor and the mom. Unfortunately, most of the providers in the US are very pro-vaccine and sort of conflicted, I would say. There's a lot of financial benefit to vaccinating. So perhaps, the reason we're sharing this information to you, the viewers, is if you have a friend or you yourself are pregnant, I mean, we're talking about at least 4 out of 100 chances you're going to lose that pregnancy. Why would a person, and I think, Josh, you'll explain that it's probably actually higher than that for a couple of reasons, healthy vaccine bias, and I think you've got a couple other reasons.
Right. So let's talk about that for a minute. So what is the right baseline to do this observe to expected? Usually the way it's done, and this is a common methodology in vaccine safety research, you take some historical data, you look at the number of events that happen over a certain period of time, and then you look at the current period and you say, okay, if this person was vaccinated and we look at them for a month, based on that historical period, we would expect to see 5 cases of myocarditis, let's say. And what do we see? Oh, we see 30 cases of myocarditis. There's a safety signal here. And the CDC did this when they were looking at for myocarditis signals. They rarely adjust for more than like age and sex. So, what is the population against which we should be looking at, or we should be creating sort of an expected rate? And what we do is we use historical information, very detailed individual level information, to build a statistical model. What is a woman's chance of losing her pregnancy at some point, given her baseline characteristics, given the calendar month of her conception, and given the week of pregnancy in which she is? And our model, it does a very good job of predicting, or let's say that if we look at all women or unvaccinated women using this model, we see very little difference between the observed and expected chances of fetal loss. When we look at if you got vaccinated for COVID during these weeks, we see this big difference. And later weeks, we don't see it. And so I don't know, if you want to say it's safe in later pregnancy, our data doesn't show a signal for getting vaccinated later in pregnancy. But some people come and say, well, look, the COVID period is very unique. It was totally special. How can you compare the historical period to the COVID period? And so what we did was we looked at women who were vaccinated for influenza during the COVID period. And what we found was something starkly different than the COVID vaccinations. What we found is that women vaccinated for influenza had a lower than expected number of fetal losses. So if you look at this figure, this shows on the x-axis, it shows what week was the woman vaccinated, and then what is the observed number of fetal losses per 100 women. That's the solid line compared to the expected number. That's the dotted line. And what you see is that for those early weeks for COVID vaccination, it's much higher than the expected. For some weeks, the difference is much more than 4, but if you average over those the first trimester weeks, it's additional 4, 3.85. Okay. But then if you look over on the other side where there's influenza vaccination, you see the opposite. The observed is much lower than expected. It's about 5 fewer fetal losses per 100 women for those first trimester weeks. So why is this? Why are women who are getting vaccinated for influenza they have a much lower than expected number of fetal losses? And the reason, we believe, is not a protective effect of influenza, but what is known as a healthy vaccinee effect. And a healthy vaccinee effect or healthy vaccinee bias is a well-known phenomenon, and it essentially means that people who get vaccinated tend to be healthier on average, tend to have sort of health-seeking behaviors. Like, for example, I have a friend who has to fill out a survey every year to renew his insurance. And one of the questions they always ask him is, do you floss your teeth? He doesn't have a dental plan. They ask him that to kind of get a sense of what is his general approach to taking care of himself. So this is a problem that biases a lot of studies of vaccine efficacy or effectiveness. Why is it not a protective effect of influenza? Well, if you recall, during the COVID period, especially one of those years, there was essentially no influenza going around, or at least that's what we were told. But we redid our analysis for an early year, 2018 to 2019, and we found the same difference. Now, 2018, 2019 was a really bad influenza season. So we have a really bad influenza season and basically a no influenza seasons, and we see the same result. And what that means is that it can't be a protective effect of the influenza vaccine, and no study has ever suggested such a large protective effect. It is a signal that there's some healthy vaccinee bias. This is something that we can't measure very well, but it's affecting the results. And one of the reasons we probably can't measure it very well is because it's very dynamic. It's something, something is happening over the pregnancy. Women who are bleeding, who are having cramps, who are having some kind of issues with their pregnancies probably aren't going to go out and get vaccinated. Women who are more, whose pregnancy seems to be doing well, they're feeling good and whatever, maybe they're more likely to go out and get vaccinated. We don't know the exact mechanisms, but we can speculate. So essentially there's sort of this time-dependent healthy vaccinee bias. Now, if it's the case that we would expect women who were vaccinated for COVID to be similar to the women who are vaccinated for influenza, they're health-seeking, they're going out, right? Their pregnancies are doing well. We would actually expect the COVID graph that we just showed you to look similar to the influenza, because they have this there should be some healthy vaccinee bias. Maybe not as much as the others, influenza, we don't know. But if it's the case that there is, then what that means is that the baseline for the COVID vaccination actually should be much further down, where you see the black solid line for influenza. That really is more like what we would expect. And in that case, that means that instead of 4 additional fetal losses per 100 pregnancies, we're looking at something upwards of 9 additional fetal losses per 100 pregnancies. That's a huge number of lost pregnancies.
That's almost 1 in 10. What mom would choose to take a procedure, the COVID shot, if they were actually told that there's a 1 in 10 chance this will cause you to lose your pregnancy?
I don't think any woman in her right mind would take a COVID vaccination at that. Now, I want to say something about what you were talking about earlier about doctors recommending this to pregnant women. So there have been a lot of studies on this, right? So a well-intentioned doctor wants to take care of his pregnant patient is going to look at this body of research. There's already been meta-analyses and whatnot. You say, aha, COVID vaccination is totally safe in pregnancy. But they don't really dig into the details and try to think about, well, what are they missing here and what are the biases? So for example, there's a lot less research on COVID vaccination in early pregnancy. Another problem is that most of the studies, if they do look at earlier pregnancy, they're only looking at fetal losses until week 19 or week 20, right? Miscarriages and not stillbirths. And the ones that look at vaccination later in pregnancy aren't going to find this. And the ones that look at earlier, if they don't look past week 20, they're going to miss a lot of the signal. So it's very easy for these results to kind of get missed based on the different ways that they're slicing and dicing the data. I don't know that they're doing it purposely to hide the signal, but the way that they're going about it. Another thing that because what they generally tend to do is they generally tend to compare women who are vaccinated vaccinated versus unvaccinated women during the COVID vaccine drive. And a number of problems with that. One is it often leads to a short follow-up time because of the way, I won't go into all the details. But another problem is that it suffers from this healthy vaccinee bias where the women who are getting vaccinated are kind of have better outcomes just on the basis of that bias compared to unvaccinated women. And so if they look similar, that's actually a signal that there's a problem. There might be a problem because they shouldn't look similar. They should look better than the unvaccinated women on the basis of healthy vaccinee bias.
That is a very confusing thing for most people. And I just have to let you know, if you're watching this, this is important. And you are hearing from a very skilled scientist, researcher. In fact, what's your Substack called? I think you changed the name recently.
Yeah, researchrebel.substack.
Research Rebel. I love that. Check out Dr. Guetzkow's Research Rebel Substack. It's really well done. If you were to advise someone who's about to be pregnant or is pregnant on, now knowing what you know, what would your recommendation be?
I'm not a medical doctor, but I would, by the basis of our research, I would say I would not recommend it. And even though our research shows a signal for the first trimester, what it indicates to me is that there's a lot more potential for harm. We don't understand the mechanisms. How are these things related? If it's a causal relationship, what are the mechanisms through which it's working? And I would caution any woman thinking of vaccinating with an mRNA vaccine in pregnancy to wait until we understand what are the implications for the fetus, because we're only looking at pregnancy loss. We're not looking at any other type of problem that might be associated with mRNA vaccination. But it suggests that there are mechanisms of action that may not cause the fetus to be lost, but they may cause other types of harm. Paul, there's one really important message that I want to make. One last, I don't know how much longer we have, but one thing I definitely don't want to forget mentioning. Another figure that's been thrown around a lot is 80%, 81%, 82%, 86% miscarriage rate associated with COVID-19 vaccination. Those numbers are based on two different sources of data, and both of those numbers were calculated based on a complete misunderstanding of what the data in those sources was showing. So although the sources that they relied on, one was a publication by people at CDC, another was a Pfizer report on adverse events that were being reported. They both showed a reason for concern, but those numbers, the 80% number is just false. It's a shame that people are still circulating those numbers, and but that is what it is. But I want your readers to understand that is just a misinterpretation of those reports. So those numbers are wrong.
Yeah. I know you and respect you well, but our viewers, some of them may not. And also, I just wanted you to have the opportunity to introduce who else was working with you on this important
paper. Thank you. Right. Yes. Thank you. I had an amazing team that I was working with. So Tal Patalon and Sivan Gazid are at the Maccabi Healthcare Services Research and Innovation Center, and they worked with us on the analysis and the design, and also got us access to the data. This is very, very rare. It's very rare that people critical of vaccine safety are given access to individual level data. I want to say critical of vaccine safety, they take a careful approach to examining vaccine safety would be a more appropriate way. And another person that we have on the study is the head of OBGYN services at Maccabi Healthcare Services, a senior physician. So these are all three of them are physicians. We have Tracy Beth Hogue, who's also a physician. She's now a senior person at the FDA. And she's done amazing research on non-pharmaceutical interventions during COVID and showing the harms that they cause. We have Joe Freeman, Dr. Joe Freeman, who wrote a paper reanalyzing the original vaccine trials, COVID vaccine trials, showing high rates of adverse events. And then finally, last but definitely not least, is Professor Retzef Levy of MIT, who is now a new appointee on the ACIP committee, the Advisory Council on Immunization Practices. So he's going to have a very influential role there. So this was just an amazing opportunity for me, and hopefully not the end of this. We have plans for additional research on related topics.
Thank you so much. I mean, this is such a large, powerful data set of real world data that, rarely do you get access to, as you mentioned. So I'm excited that this information is getting out to the world and that people will hopefully realize the importance of what you have found and what you are publishing and take action. I mean, pregnancy is a time, moms, you intuitively know this. You don't put anything into your body that might harm your unborn child. Your child's developing an immune system. Their brain is developing. Everything is going on, and you want to shelter them from harm. We already know many of the mechanisms of harm, mRNA in particular, very immune activating, and what it might do to insert genetic material into the developing genome of the baby. This is territory you just should not be even entertaining, especially while you're pregnant. I'm going to give you the last words. And also, I'm just curious if you have any thoughts. I know you continue to do research, maybe what's coming up for you that you're looking into. And I wonder if you have any thoughts on the future for our world as relates to these infectious disease, pandemics, whatever you might want to call that.
I'm trying to remain hopeful. I was extremely buoyed when I learned that Professor Retzef Levy was appointed to the ACIP. I know him very well. He's a man of great integrity and very data driven. He doesn't lead the data leads him. And so, he's not going to sit there cooking the books or turning a blind eye. And so I hope that there are other members on the committee that are of similar mindset as him. The fact that there is now people in positions of great influence that 2 years ago, it would have been, who would have imagined? The last time that we talked, I never in a million years would have imagined we would have somebody like RFK Jr. As head of HHS. I know people are disappointed in many ways, and hopefully they will be proven wrong. And time will tell. But just it's really an amazing time. I think one of the things that we're going to see now, though, is a backlash against that. So people are going to dig in their heels before there's any real substantive change. So we may see more conflict and more. It might be a one step back, 2 steps forward kind of situation, but I'm hopeful.
Yeah, I am too. Josh, I want to thank you so much for coming on the show. We're going to have a link to this actual paper in the show notes here, and I'm sure we'll have you back at some point. Thank you, Josh.
Thank you, Paul.
Well, folks, that's a wrap for this week. I want to just let you know you can reach me at kidsfirstforever.com, and it's always a pleasure to have you on our show. I look forward to seeing you next week. And if you haven't gotten a copy of my latest book, Vax Facts, you need to get this and get it in the hands of every person that's considering having children or that has children. It is your guide to informed consent on vaccines. We'll see you next week.
Okay, we're live. Tell us your name.
Natalie Campbell.
And Natalie, what have you done? You've made your own study.
I did my own study. I was in a homeschool group and I started talking to mothers of families who had both vaccinated and unvaccinated in the same household. My first family, they had 6 children. The first 3 were vaccinated and had the normal health conditions, and the second 3 were unvaccinated, and she called them super healthy kids. I thought, this is interesting. So I started seeking out families like this to interview. And I did it all by telephone interview. And I interviewed 35 families that totaled 200 children.
Where did you get the 35 families from?
Mostly they were in my homeschool group or local Michigan homeschool groups. Some, my doctor, Dr. Brownstein, let me collect people at his office too. So I had those 2 sources and just whoever I could think of.
And what were the results of your study then?
Okay, the results, there are 4 possible outcomes. I could have vaccinated with a health issue, and they mostly had more than one health issue, many health issues. Okay, of my 200 children, 68% were vaccinated, 84 children of the 200 were fully vaccinated and had a health issue. 40 of the children were vaccinated but did not have a health issue. Of the unvaccinated, this is totally unvaccinated, 15 children had a health issue, so that is 20%. Of the unvaccinated, 61 children were perfectly healthy. So those are my results.
So when you say unvaccinated, did you take into account the vitamin K at birth?
No, I didn't. I didn't take into account vitamin K at birth. I probably should have. It came up as it went along, but
no, you're not the only one. I mean,
everyone had it.
Brian Hooker and Paul Thomas, they didn't either, because it's very hard to get the records of vitamin K.
Right.
It's most of it done in hospital. But we do know that those that take vitamin K are injured.
Yeah, in fact, I did interview a family who I think did have an injury from vitamin K.
Anything else you want to tell us about your study?
Yeah, okay, this is just the first page of all the conditions. For instance, I know you're interested in autism. I had, of the vaccinated, 13 children had autism spectrum. Of the unvaccinated, 2. The other interesting thing about the autism spectrum was the children who were born before 1986, I had 1. And the children who were born after 1986, when they increased the vaccine schedule, I had 13. So there's a real difference. If the original schedule for about 20 years was 16 doses of 7 vaccines, and now it's up to 72. So starting in 1989, it really went up, the autism. And most of these conditions went up. I started another study comparing vaccinated children with families who had some before and after 1989. Because in my own family I had that, and I actually had a mild learning problem in my 4th child. But COVID came along and I didn't continue. But the thing I really want to stress is from Dr. Paul Thomas. He says in his book, The Vaccine Friendly Plan, if you have autoimmune conditions in your family, you're very susceptible to a vaccine injury, and you should either not vaccinate at all or wait till they're 5 years old. And I found this to be very true. In fact, my worst family had 3 autistic children and 1 ADHD child. The first autistic child, he's in his 20s, he is nonverbal, he wears diapers, and he has seizures. I mean, this is a horrible life. But then they had 2 more autistic, and the mother has ulcerative colitis. So we definitely have the autoimmune component in there.
And I just have to say, on the back of you saying, or delay, some of the worst stories we've had are when people delay. Some of the worst stories we've had is when, we recently just did one with a 5-year-old.
Ooh, delay, what do you mean?
crippled. So the point is, there is no such thing, with all due respect to Dr. Paul Thomas, to a vaccine-friendly plan. I cannot emphasize that enough. If you're listening, there is no such thing as a safe and effective vaccine. So there's no such thing as a safe, friendly plan.
No, okay.
So it is very important. I'm sorry, but I've
Yeah.
been in this game for too long, and I cannot afford to have somebody think that it's safe to take one vaccine. But I do appreciate, we appreciate your work, what you've done, and you did this speech at the Western Price, right?
Yes, I did in 2019 in Texas.
Well, thank you for all your work
Thank
and
you.
for all you're doing to warn people of the dangers of vaccinations and COVID shots and things like that. Thank you
Okay.
so much.
Okay, thank you.